Move to item 6A, which is our update on the COVID-19 situation. We will start off with Todd Leopold, our CEO, and then we will also bring in Dr. Aimee Sisson from Health and Human Services, our public health officer. So Todd, you may kick it off.
Okay. I will start off with a kind of county operational update, give you a little background and information regarding how the operation has kind of weathered this situation over the last number of weeks, and what we're seeing not only currently to date, but what we're proposing and some future potentials in the future. So let me just start off with the infrastructure. So we've been really fortunate. The investment that the county has made over the last number of years, really around technology, has allowed us to have a large number, and approximately we have a little under 9% of our workforce that is currently unable to do their current job functions from home, but they are being reassigned to other departments that may need that assistance. Specifically, our Community Development Resource Agency has been requested to have some administrative staff to assist them as well. So we're trying to utilize the staff as most appropriately as possible, but also understanding that some functions just don't lend themselves as cleanly from working and teleworking. But we do have a vast majority of our staff doing that. Our infrastructure from a technological standpoint is held up very well. Our current bandwidth has been optimal. We have a little over 1,100 workers that are logging into our network on a daily basis to do their normal tasks, and the network is actually held up extremely well. And I do want to give a thanks and a support to our IT staff, who's done a very good job of kind of putting an infrastructure in place to allow this to happen. It also provides us the opportunity, the investment that you made with our Workday system from an internal standpoint. All our individuals are able to, from either a financial standpoint or an HR payroll aspect, to log in and track their time and manage that appropriately from their home locations, which was unavailable prior to the implementation of our Workday system, even as recently as about 6 months ago. So from that standpoint, that's actually worked very well. Let me give you a little update about some of the functions that we're doing in the county right now from an operations standpoint. First off, our Emergency Operations Center has been at full strength for a number of weeks, really since the March 16th time when we moved to a modified work schedule. These daily updates that have been occurring are in partnership with our other jurisdictions, our law enforcement community, and our fire operations. All have been working in joint command alongside our HHS operations. Dr. Sisson and Jeff Brown have been instrumental in working collaboratively in that arrangement. As far as day-to-day services, our building permits, we just recently received an update. Building permits were actually up in March, and all handled through a online or a virtual environment. That has been actually really exceptional. It gives some good hope. I think there's some positivity that's also continuing. Our ultimate goal is to keep this operation moving in the community in general, even with the orders, and doing it in a safe manner. From a road work standpoint, Public Works is continue to have a road maintenance crews. They remain active. We do have staggered work schedules to accommodate the guidance that's provided by the Public Health Office, but we're ensuring that those critical infrastructure needs remain intact, and where we identify road and transportation and bridge improvements, those are continuing to go on as normal. The same holds true for the activities that have been taking place over the last 2 months around the weather up in kind of our eastern Placer County, Tahoe region. Snow plowing continues and maintains in the same facet as we currently have had in prior years. So that has not changed at all. As far as park operations go, all of our parks remain open, although we do have play areas that have been closed, consistent with the order that has been put in place. But we have some good social distancing facets in place, one being our limited access at our regional park facility, Hidden Falls. We did minimize the number of day-to-day visits for those that are doing reservations at reservation systems on a seven-day-a-week schedule right now, and we do want to ensure the safety of our residents. But all these projects and parks remain open and are accessible to our residents. As far as internal operations, our treasurer's office, even though they don't have a front counter, the individuals are able to make their payments online, or they can drop off their payments at the office, and staff is able to take those. So we just moved through the our April 10th deadline for our property taxes for the second piece of that, and that went fairly smoothly. Our assessor's office is still remaining all working remotely, but they're working on their assessment efforts, and that continues to take place. As far as our clerk and recorder's office, there's a greater use of e-recording services, so that, again, technology has allowed us and really provides other opportunities for people to interact with us. And so our e-recording services, even though we've had that for quite some time, is heavily used and seems to be working appropriately in the manner that it was kind of constructed to do so. Some of the positive outcomes, I want to touch on this because I think it's really important. We have been able to, I'd say, experiment with some opportunities to engage our residents in a different manner than we have previously. And I think many of these will hold true as we move into more normal course of operations. The most important one, I think one that our business community will really appreciate, and our development community, is our video inspection services. We have a number of building inspectors right now, but as many of you out there have seen, we have a number of projects that are either teed up or scheduled to move forward in the near term. It's going to be taxing on our building inspectors to keep up with that demand. So what we've instituted a video inspection services where we work with those developers and those contractors where they're bringing in video feeds or pictures, and where our building inspectors are able to make determinations about those inspections without having to be on site. That is going to allow us to give us some more opportunity with the staff that we have to expand our service delivery. So we've experimented with this. This has actually gone live. And I think it's been well received up to this point. We also have a number of opportunities where we have electronic signature verifications, where before it had been manual in nature, and that delayed the time period to do so. We've instituted that specifically in our Cedar operation, where we are routing information in a more manual fashion. This electronic signature verification really has expedited the review process, and we're looking to roll that out to some other departments that are doing similar manual signature verifications. We also have a number of e-services, so that need and use is growing pretty extensively. And finally, this is all about collaboration. Really working with our jurisdictional partners. I meet with our city managers around the county on a weekly basis to really talk about where we can work together, specifically in our law enforcement arena. But I think there's a lot of other opportunities that have kind of presented themselves in the same manner as we're talking about this unknown event. Finally, I'll just say, from a future potential standpoint, we have a number of staff that are working remotely, and they're doing actually a really fabulous job. I think there's a great productivity that continues to take place, and things that we've talked about, but this is give us an opportunity to experience and look at those. Where we see opportunities to do that, we want to maybe continue that effort. We have a teleworking policy that has been put in place, but we're looking to formalize that so when the emergency and we get back to normal, there are going to be some staff and some positions that probably lend themselves to working from home. What does that do for us? think it's a good thing for our employees, for one thing. I think it gives them some opportunities to work remotely and have that flexibility. But internally, we're looking at space. And as we talk about growth of this county and the needs and demand for services, infrastructure is critically important. And so this gives us the opportunity to look at our buildings and our infrastructure to say, what is the growth that we need? And potentially we don't need to expand or provide that amount of space for even if we bring on additional staff in the future. So I think there are some silver linings that are coming out of here from the internal operations. And what I've really said to not only our department and our staff in general is this is an opportunity to look at service delivery in a different way and hopefully better. And we have a number of employee town hall meetings that are going to happen through the course of the rest of this week and then the first of next week, where I'll be able to talk with individuals via online video conferencing. There's been some great questions that have come in to date. I think right now, as of yesterday afternoon, we have about 150 employees will be on a virtual town hall. So my ultimate goal is to keep us aligned and as an organization, as an employee base. Our department director's been really good about keeping our employees engaged and active about what's going on in their individual departments. So I'm going to leave that there. If there's any questions you may have of me, but I will tell you, I think the organization's in good hands. And even though not every citizen's seeing our employee base out there on a daily basis, behind the scenes, I think everybody is doing a real good job, really focus on making a difference in this community. And that's why they're working here, and that's why we're doing kind of some of the creative things that we're exploring and piloting right now.
Great. Thank you very much for the update. Let's see. Supervisor Euler and then Gustafson.
So, Todd, prior to April 11th, we had a lot of inquiries from folks about delaying property tax. Of course, the governor would have to have taken action to allow for a delay in requirements of property tax payments. He did not do so. What I'm wondering at this time, do we have any idea what our property tax delinquency rate is comparative to other property tax filing periods?
I will have a number for you next, probably our next board meeting. I know we just closed. There was a fair amount of payments that were still yet to be received by the treasurer. I know as of last week, our property taxes were off. I believe the number is about 3.5% had it been collected. That is obviously that number is going to go down as we have some outstanding payments. I'll have a more finite figure. I will tell you, my guess is that it will be lower collections than what we've seen previously. We are a teeter county, which means the county actually offsets payments that aren't received and given to those other taxing entities. I think this is why we'd like to have a conversation in the next 2 weeks, because that number could be fairly sizable. I know outstanding, we had about $36 million that we saw countywide hadn't been received to date. That number hopefully will be less, but I think we need to be really crystal clear about how we handle that from a teeter standpoint, because what ends up happening is the county typically sends that money to those other taxing entities, and then when the repayment comes back, the county receives that money at a later date. And we want to know what the magnitude is. So I will have the number for you, and this may be a good conversation with the treasurer as well to talk to this.
Okay, thank you.
Yep.
Supervisor Gustafson.
First off, as I mentioned earlier, I've gotten a lot of feedback and really positive feedback on staff's productivity during this period of time, especially those in the construction industry who've been doing the online inspections and really appreciating that support. Certainly, I've been working a lot with code enforcement on the short-term rental issues on the eastern side of the county, and really appreciate all the effort that has gone into that. I wanted to echo some comments that Supervisor Euler made earlier on looking at economic recovery plans and how we look at reopening so that it isn't a light switch that went off and then just comes back on without helping the businesses understand what the ramifications are going to be. And I know none of us can predict exactly what the governor is going to do, but we certainly have influence through Dr. Sisson with her participation in the statewide task force. I've asked the businesses that I've talked to with the Auburn Chamber and the North Lake Tahoe Resort Association Chamber to meet with their various industries, as Mr. Hentz said earlier, and come up with what they'd like to see. What would they like the health officers to understand about their businesses, and what they think might be ways to reopen, and a transition plan that gives them more than 24 hours to react, because sometimes these orders seem to come down in the middle of the day or evening or on a Friday afternoon, and then there is an opportunity for response. So I'd like to really encourage us to have some thoughtful dialogue with the business community. Some of them need to restaff. They need to get people out of unemployment back on their payrolls. That's been a challenge for some. Get restocked and ready to open. There's a real concern, especially in eastern Placer County, about Memorial Day, and that the pressure for people to get out and get going places, and it will impact all of our recreation facilities throughout the county, but especially the eastern county. And what do they need to be prepared for, and how long will they know in advance of when restrictions will be lifted and what sort of protocols? They'd like to participate. Many of them would like a more staggered and slower ramp up because they've never been through this either, and they don't want to disappoint visitors and guests. And then I think there's a role for the county as well on parks and recreation in particular, and how we fulfill expectations for folks and what guidance that we can provide. We're going to need to have probably some reminders with additional signage and information to visitors on how best to use the trails, or to park at trailheads, or use the restrooms, and what we're going to do. So there's a lot of thinking that's going to go into reopening, and there's a real concern that it not just be a light switch back on and pandemonium, that we really try to handle that. And I'm sure the governor's thinking about that as well, but I can urge you, from a small community up there, they are really considering potentially delaying their opening of their lodging compared to whatever the governor or our health director would say, so that there is a more moderated demand on restaurants and retail businesses and recreation providers, that those people can get up and operating to serve. So I'd like to urge us to take a leadership role in that, and also to considering other types of fee waivers or penalties where we can. With TOT, for instance, I've been told by the lodging community they had to refund millions of dollars of deposits on hand. And cash flow wise, it would be very helpful to have a longer period of time to pay what was owed. Those sorts of things, I think, are going to be part of an economic recovery package that this board, I know my colleagues well enough to know that we would support what we can do to help our business community recover well from this first in our lifetime event. Yeah. So,
well, I will share with you, this has not gone unnoticed, and hasn't been. It's been something that's been discussed, and Dr. Sisson may talk briefly to this as well today. We're talking about our business community, and I think we have some framework that we want to discuss, and in concert with HHS, with Dr. Sisson, about reopening. But I think you really touch on, there are other industries and other parts of this county which is very unique. Just different sides of the county that have different needs, and we want to make sure we address both of those. So I think points well taken. I think we have at least a good starting point, but I think you're going to hear much more about a structure here in the next couple weeks.
One more question.
Yep.
I heard earlier today, I attended a virtual meeting of the Auburn Meddlers, and the police chief there was talking about some increased property crimes that he's witnessed, and I wanted to see if our sheriff had a similar report and of those sorts of things, as well as getting folks arrested that then immediately got released and then got rearrested in several situations. So.
Thank you, Supervisor Gustafson. Supervisor Euler, any other comments?
I'm sorry, no.
Okay. All right. Thank you.
I I'm not sure which light to turn on here, but
Oh, you're,
Yeah.
oh, that's why it says Karen. You're not Karen. I was wondering why Karen's light was on, but it says Karen. Okay,
I won't
you are
even-
now Karen today.
won't even
Thank
touch
you.
that one, but I'll start using the other light.
Identify today.
I just want to, Todd, I know it's been, this has kept you unusually busy. I think most people understand that the five of us that sit up here get to craft all kinds of wild and crazy policy ideas, and then you're the one who gets to see that they get put into place and work. And times that I've been up here, sometimes things have changed actually hourly. But from my perspectives and the feedback that I've gotten, mostly things have gone incredibly smoothly, and so thanks to you in particular, because you're in charge of that, responsible for that, and particularly our department heads and all of the employees who I think have figured out ways to make things work well.
Agreed. Supervisor Holmes?
Yeah, I want to echo that. Many of the departments have been very receptive. My emails, you're probably all getting a lot of emails, but we're getting the information back to the constituents, and the departments have done really well getting back to us in a timely manner. I want to shout out to the clerk recorder's office. A friend of mine's daughter was trying to get a wedding license. Yes, young people sometimes get married. So anyhow, we were able to get this couple a wedding license so they can get out, a marriage license so they can get out and get married. So I want to shout out to the clerk recorder's office for their response.
Yeah, I'm just really proud of not only the leadership here, but the department directors and the staff. They've been really good and just nimble. I think we need to remain that way as we kind of move forward. So
Great.
I
Thank you,
appreciate it.
Todd. And so now we are going to have an update from Dr. Sisson. She should be on Zoom. And first off, I just want to say thank you, Dr. Sisson, to you and your team with Health and Human Services. I know you all have been receiving questions and comments, emails, phone calls. So thank you for your hard work. We appreciate it. And with that, hopefully we've got you online.
Okay, good morning. Can you hear me okay?
Yes, thank you. Good morning.
Okay, good morning. Thank you for the opportunity to provide an update to the board today on coronavirus. I plan to share with you where we've been, where we are now, and where we're going with regards to COVID-19 in Placer County. And I'd like to begin by recognizing that while I may be the face that you see and the voice that you hear during these updates, I am part of a much larger team that is working around the clock to address COVID-19. So I want to thank all of the public health and health and human services staff who've risen to the challenge that we are facing, as well as our terrific partners, including the Incorporated Cities and Town in Placer County, the Office of Emergency Services, CAL FIRE, Placer County Fire, the Placer County Sheriff's Office, Sutter Auburn Faith, Sutter Roseville, and Kaiser Roseville hospitals, our local clinics, the Gathering Inn, local community foundations, and many others. I'd also like to thank the Board of Supervisors for responding to input from constituents. And most importantly, I want to thank Placer County residents for the sacrifices you have made. Your actions are saving lives. It's not lost on me that there is a cost to staying at home. Many of you have lost income. Some of you have lost businesses. We see you, we thank you, and we will be here to help you recover. Next slide. Let me begin by reviewing our current Placer coronavirus numbers. As of this morning, there are 133 confirmed cases of COVID-19 in Placer County. The cases are concentrated in South Placer, where the majority of Placer residents live. To date, there have been 8 deaths from COVID-19 in Placer County. I encourage people to visit the coronavirus dashboard for additional details on cases. Next slide. On March 19th, I issued a health officer directive requiring Placer residents to shelter in place or stay home except for essential activities. The directive was prompted by an increasing number of cases in both Placer and surrounding counties. The goal of sheltering in place is to flatten the curve, to avoid a large number of cases all at once that could overwhelm the healthcare system and result in deaths that could have been prevented if they'd been spread out over time. My directive was followed the same day by a similar statewide executive order from the governor. On April 10th, I renewed the stay-at-home directive as an order, clarifying areas of ambiguity in the original directive. On April 16th, I amended the order based on community concerns to allow outdoor recreational activity if specific protective measures were followed. Next slide. If we look at people hospitalized over time in Placer's 3 hospitals, we can see the benefit of the stay-at-home order. Yesterday, there were 8 confirmed COVID-19 patients in Placer hospitals. For perspective, when I last spoke to the board 2 weeks ago, there were 18 hospitalized cases. There are 467 licensed beds in Placer's hospitals, including 58 ICU beds. The robust surge plans of these hospitals allow for expansion to over 1,000 hospital beds, including 270 ICU beds. We have flattened the curve, and if we stay the course, we're unlikely to need these extra beds. Next slide. The current health officer order to stay at home is in effect until May 1st. At that time, the options will be to renew the order, revise the order, or to let the order expire. If the order is allowed to expire, this does not mean that Placer County residents no longer need to shelter in place. The governor's executive order remains in effect until further notice. The governor's order permits critical workers in 16 sectors to work and allows persons to leave their homes for food, medications, and health care. The executive order itself is silent on recreational activity, and although state FAQs provide some guidance, remaining under only the executive order after May 1st will create ambiguities in this and other areas. Next slide. One topic that there is no shortage of discussion about is coronavirus testing. Testing is a critical piece of the coronavirus puzzle. Without widespread testing, we're working in the dark. Testing capacity is increasing, but it remains inadequate. The statewide goal for California is to conduct 25,000 tests a day by the end of April. Placer's population represents 1% of California's population, so Placer needs to be able to conduct 250 tests per day by the end of April. Placer's current testing capacity is closer to 150 tests per day. These tests are sometimes conducted within minutes at the point of care, but are more commonly done at hospital, commercial, and public health laboratories with turnaround times of 8 hours to several days. As testing capacity increases and more tests are conducted each day, public health will begin reporting a new measure, the test positivity rate, to help determine if any increase in cases is due to increased disease or simply reflects increased testing. As testing capacity improves, we need to expand testing for vulnerable populations, especially those in congregate settings like long-term care facilities, homeless shelters, and jails. Next slide. We can't shelter in place forever. While sheltering in place minimizes opportunities to transmit coronavirus, it's not realistic to continue staying home until we have a vaccine, which will likely not come for 12 to 18 months. We need to balance the need to protect people from coronavirus with the need to earn a livelihood and be social beings. However, releasing all limitations and returning to business as usual and life pre-coronavirus right now would be a big mistake. It would undo all of our hard work to date to flatten the curve and likely lead to the very surge in cases we've been trying to prevent. We need to reopen, but we need to reopen thoughtfully. One such thoughtful approach to reopening has been put forward by the American Enterprise Institute. I'm sharing this framework not as a polished plan for Placer. I'm sharing this as a framework, not as a polished plan for Placer County. Any local plan will be consistent with state requirements and guided by promising practices. This is just one example of what is being looked at. Under this example framework, we are starting in phase 1 with stay-at-home orders, and once we meet certain criteria, we can move safely to phase 2 with gradual reopening. And once there is a vaccine, we can move to phase 3 and lift restrictions. After that, we need to rebuild for the next pandemic in phase 4. Next slide. I'm going to weave in another framework, this one outlined by the White House Coronavirus Task Force, albeit with different numbering of the phases, to provide more detail about moving from phase 1 to phase 2 and progressing within the 3 stages of phase 2. Before gradual reopening can begin, we have to have 4 things in place. A steady decline in new cases, as measured by the test positivity rate over 2 weeks, improved testing capacity, the capacity for the healthcare system to treat everybody who is ill without putting healthcare workers at risk, think adequate PPE, and a robust ability to trace contacts of cases to quickly separate them from others so that they don't spread disease. Of these 4, we have only satisfied the first criterion of declining case numbers. Once we meet all 4 criteria, we can safely begin loosening stay-at-home orders. In phase 2A, this might mean allowing small gatherings of up to 10 people and opening up venues like restaurants with strict distancing requirements. If we enter phase 2A and don't see a surge in cases in the subsequent weeks, we can move to phase 2B. If we do see a surge in cases, we might have to return to phase 1. In phase 2B, larger gatherings of up to 50 people would be allowed, and schools could reopen. If there's no surge in cases after this loosening, we could enter phase 2C with even fewer restrictions. Next slide. As we start thinking about and discussing reopening, I want to be clear that we will not be returning to business as usual right away. We will instead be entering a new normal. In this new normal, we will continue to maintain physical distancing whenever possible. We will need to wear face coverings when distancing isn't possible. Temperature checks before entering workplaces and stores will be common. And of course, we will need to continue to wash our hands regularly and disinfect surfaces often. Next slide. In summary, I'd like to close with 3 key points. First, staying at home is working. Second, we can't stay home forever. And finally, as we gradually reopen, expect things to look different in order to keep people safe. Thank you, and I'm happy to take any questions.
Thank you, Dr. Sisson. I appreciate the update. Supervisor Wygant, questions?
Good morning, Dr. Sisson. Question. So the framing for this is that I think it's really important in the long run and the short run that local communities have the best possible understanding of exactly what happened in each one of those communities. And I'm strongly leaning towards the idea that I like the feel of counties across the country having more of a voice in exactly how we manage ourselves. And so with that, I've been intrigued lately. Last Friday, I think it was announced, the Stanford study that relies on antibody testing and found some startling results. And that seemed to be replicated yesterday, a study in Southern California, USC, UCLA. So I'm anxious to hear your comments about that and or whether or not you're planning to pursue something similarly.
Sure. So the study that you're referring to out of Stanford was around antibody seroprevalence in a population in Santa Clara County. And, I think the findings are very interesting. I think we have to consider them we have to keep in mind the limitations of that study. One, I will state that it is important to look at antibody testing, but that's not yet widely available. And I would point out that there are only 4 antibody tests that have been given an emergency use authorization by the FDA, and the test that was used as part of that Stanford study was not one of the 4 that have received the FDA approval. approval. And so the reliability of the results of that test have not yet been demonstrated. So I would just be cautious in generalizing the results from that study, but certainly the preliminary results suggest that infection has been more widespread than we have detected. And I think, we've been saying that for a while, that the cases that we've detected are just the tip of the iceberg, and there are more cases out there. Certainly, if the prevalence is higher, it does have implications for the mortality rate of coronavirus. But again, we've been saying from the beginning that there's a lot that we don't yet know about this virus. And I think we don't have a great sense of what the mortality is. And the estimates that we saw initially were very high, and we don't yet have great numbers. And so I think, one of the things that we do in public health is act using what's called the precautionary principle. And I think based on the data that we had at the time we made these decisions and the data that we continue to have, it remains important to shelter in place.
Thank you. And going forward, I think both in the hopefully shorter term future, but definitely looking back a year and even two from now as we better prepare for these kinds of things. I'm particularly interested in what we learn as it relates to the spread rate, mortality rate, but also the timing of the spread here in Placer County. So thank you.
Supervisor Euler?
Yes, thank you. Morning, Doctor. Doubtful that this morning you had a chance to see Forbes has posted an article just about 3 hours ago. Headline, Sweden, 600,000 coronavirus infections in Stockholm by May 1 model estimates. Quoting the Swedish Public Health Agency, they said they've collaborated on a new study that estimates that 1/3 of all Stockholm residents will have been infected with COVID-19 by May 1. That amounts to approximately 600,000 people in Sweden's capital city. Sweden's official figures only report 15,000 positive cases so far in the whole country, suggesting a significant number of invisible infections. Then when you compare that to the mortality rate in Sweden, currently reporting, as of updating within the last 24 hours, reporting 1,765 deaths in a country that has a population of a little over 10 million people, and the understanding that maybe 1/3 of just the capital city alone may have been infected, it really drives this mortality rate down, indicating, as a number of more recent studies are showing, that while this particular virus is extremely contagious, it doesn't seem to be anywhere near as deadly as had been presumed originally, based on the very limited data that we got, obviously, out of a very non-cooperative China to start with, who didn't want to acknowledge its existence at all in the first place. The point of all of this is simply to say that if, in fact, we are finding, as Supervisor Wygant indicated, and as these studies are showing, that this is far less lethal, far less dangerous, while still being contagious, far less dangerous. And the point of the economic shutdown that has driven us to now over 20 million unemployed and untold trillions of damage to our economy, if the point of that was to not overwhelm the healthcare system, and we in Placer County today sit with, I think you said 4 people that are in hospital right now with the disease, and we are seeing nationwide healthcare systems essentially in collapse, not because of being overrun, but because of having no customers, because all elective procedures have been canceled. At what point do we just say, okay, claim victory, we didn't overrun the healthcare system, we're going to focus on now healing our economy as we continue to heal those who will show symptoms, and some will, and move away from a stay-at-home order to an informed consent understanding. We know the risks. We have done the public outreach. We have educated folks on the risks. Everybody understands who the at-risk groups are with underlying conditions, aged, and all the rest. And now we as free people are free to go about making our decisions understanding what the risks are. I just, for the life of me, while we can count the number of people in hospital beds, we can't count the number of people yet who have lost businesses, who are retired and have seen their savings decimated by virtue of what's happened with the stock market. Our entire supply chain and what is right now happening with our supply chain and the price of oil having dropped because people aren't trucking, people aren't moving, people aren't doing things. At some point, and it's got to be sooner rather than later, we got to stop focusing in on just that number, that very small number, and as more and more studies seem to be showing, an infinitesimally small number of people who are actually sick because of the disease needing hospitalization versus those who have been exposed to it. And we need solid leadership in this county, not just politically, but also with our appointed officials helping us to make that case that we are informed. We understand the risk. Just as there's a risk when, before this was shut down, there's a risk when we get up in the morning to drive to work, that might be the last time we get behind the wheel. There is a risk associated with living, but life must go on. And while we are shut down like this, we are seeing more and more lives silently destroyed than what we are seeing actually showing up in our hospitals and being counted by our public health system. So I'm asking, as we look at this, and I understand in a perfect world, we'd like to have testing capacity that lets us know who everybody is. We'd like to have to know for sure what the infection rate is, and therefore what the mortality rate is. But as data comes out showing it's far less lethal, even though being more contagious than we thought, we have got to push back toward normalcy for our lives and for our economic well-being. So those are just my thoughts on this, and I hope that as data comes in showing this, you will advocate with us to work toward educating our governor and helping our governor to understand, to Supervisor Wygant's comments, just as the president extended the courtesy to the states to act independently because Alaska and New York are not the same. Siskiyou County and San Francisco County are not the same. Lassen County and Los Angeles County are not the same. So I would hope that you would work with us to encourage those in state leadership to let us have the flexibility at the local level based on the situation on the ground as we know it to determine the risk and engage in reopening our economy. That's my ask of you today.
Thank you, Supervisor Euler. Let's see. No other questions from board members, and I would, Supervisor Gustafson, and then we will have public comment, I'm sure, and then we can have Dr. Sisson wrap up after that, if that makes sense. Go ahead, Cindy.
Thank you. Dr. Sisson, thanks for all your efforts and the entire department's efforts. You know, we've thanked all the county staff, but especially your department and yourself have been at the front lines of this since the beginning, and I know just from the emails I've seen you respond to and I forwarded your direction, our residents feel as strongly, if not more strongly, than Supervisor Euler and more strongly than others to keep everything shut down and get rid of this virus. So I know there's various opinions you're trying to balance in this mix. My question is, what role do you have with advising the governor? Aren't you, I believe you're on a panel or advising the governor's office. I'd like to hear more about that and how we could provide you with appropriate information from our business community on some of the steps they'd like to have taken into account as these decisions are made.
Sure. Supervisor Gustafson. As a health officer, I participate on the California Conference of Local Health Officers, and as a public health director, I participate on the California Health or the County Health Executives Association of California, or CHEAC. And through my membership in both of those organizations, I was asked to serve on a work group for one of the 3 indicators that the Health and Human Services Agency at the state level has put forward as part of their roadmap for reopening. So of the 6 indicators, I serve on the Indicator 3 work group, which is related to healthcare capacity in terms of reopening around hospital capacity, as well as PPE and the capacity to treat things other than COVID-19 as we reopen. So while I have some influence over, I have some audience with the California Department of Public Health, as well as Health and Human Services Agency through my membership in that work group. I would caution that my influence is somewhat limited over decisions that are made at the statewide level. But I am happy to and will continue to relay the message that California is not a one-size-fits-all state, and that we do need to have flexibility. And I believe that my colleagues as health officers in other counties and other jurisdictions are sending that same message. But for now, should we choose to not renew any of our local orders, we would remain under the governor's executive order.
Great. Well, I'll just urge us as board and county staff to try to convene our business community and get some protocols and suggestions they might have to you and to others at the state level, so that the decisions that are made can be reasoned with what it's going to take to reopen business in today's environment and help our community adjust to the new normal of whatever those recommendations are going to be.
Thank you, Supervisor Gustafson. Let's go ahead and move to public comment. I'm sure we've got a number of comments on the line. 2 that I'm aware Good morning. Please state your name for the record.
My name is John Allard.
Good morning, Mayor Allard. Thank you for calling in. Your comments, please.
Well, good morning, Chair Gore and members of the Placer County Board of Supervisors. As mentioned, I'm Roseville Mayor John Allard. Let me first just apologize if my comments last a bit longer than 3 minutes. On behalf of the Roseville City Council and the residents of our community, first, I'd like to thank Dr. Sisson for the guidance she's put into place during this unprecedented crisis. It has certainly been effective in helping keep Placer County's numbers low in terms of how the coronavirus has affected our community. This has been a sigh of relief for our entire community. At the same time, we realize we can be a victim of our own success. Some people in our community mistakenly think this has been an overreaction, since the numbers have been relatively low and our hospitals haven't reached surge capacity, when in fact it's because of the orders in place that level of success has been achieved. It's a tough situation all around, since all actions result in outcomes that are devastating on different levels of our community. As we look ahead to how we start to reopen our economy, we are acutely aware that the care and caution that has been exercised to this point must remain an integral part of our behavior as we move forward. No one wants to lose ground on the progress we've made to date. Our businesses, schools, and residents have sacrificed so much to slow the spread of the virus and to ensure our healthcare system is not overwhelmed. We must maintain vigilance and look to our experts. We've demonstrated not only that we know how to do it, but that we are committed to adopting new practices and adapting to new reality. No one wants to rush this. At the same time, the discussions must begin about how to coordinate this throughout our county and our region, since the virus knows no jurisdiction lines. The City of Roseville has received dozens of emails in the last few days from concerned citizens urging the thoughtful reopening of our city in the next couple of weeks. We've been in communication with the Roseville Area Chamber of Commerce and our largest retailers, including the Roseville Auto Mall and Westfield Galleria at Roseville. We want to be involved in setting guidelines that prioritize the health, and safety of their members and their employees and their customers. We all want to find a way to allow commerce to continue in order to head off any further erosion of our economy. We'd heard from our small businesses. In fact, 111 of them received zero-interest loans as part of an over $1 million that the City of Roseville allocated to help keep our small businesses afloat. But we know the need is much greater than our resources allow. Businesses from consulting firms and hair salons to restaurants and other service providers have expressed not only concern, but commitment to sensible public health and social distancing practices. They've suggested services by appointment only, so customers aren't congregating in lobbies, operating at half capacity in restaurants to allow for distancing. They are looking for practical ways to incorporate appropriate and accessible personal protective equipment in their daily operations. Our businesses want to be a part of the solution and have a seat at the table to ensure they are operating safely so the community doesn't experience a resurgence of the virus due to lax practices. At the same time, they know that remaining closed indefinitely results in other kinds of threats to public health. The consistency within our region is important because we don't want restrictions to be greater in Placer County than in neighboring counties. It has the realistic effect on auto sales, for example, of sending our residents to Sacramento, El Dorado, Yuba, or Sutter counties to buy cars, which compounds the economic crisis our local governments have in providing police, fire, roads, park, recreation, and library services. We have to start planning based on the best advice of our healthcare experts, and we are committed to doing this slowly in phases. But we also must consider the long-term negative impacts our current policies are having on our residents. Lost jobs, lost incomes, shuttered businesses, the inability to pay bills and support families, restrictions on social interactions of any kind, depression, hopelessness, and lives destroyed, to mention only a few. These must be taken into consideration by health officials and policymakers like ourselves as we move forward. We are ready to be a part of the solution to relaunch our economy as early as is safe to do so. We strongly believe it should be the second highest priority in this effort, but it must be a priority. The health and safety of our community will remain the top priority, and we firmly believe this can be done without compounding the devastating effect on our economy that we've experienced so far. Thank you for your time and your attention. We appreciate all you do for us.
Thank you, Mayor Allard. Appreciate your comments and all the work that the City of Roseville is doing. Next caller, please.
Good morning. Please state your name for the record.
Greg Janda.
Good morning, Mayor Janda.
Good morning, Madam Chair and Supervisors. As I mentioned, Rockland Mayor Greg Janda. Thank you for allowing me to comment on this item. I'd like to commend Placer County Health Officer Dr. Aimee Sisson and her staff for taking swift action on March 19th, ordering our communities to stay at home as a way to slow the spread of the coronavirus. Over the past 30 days, our collective communities have worked together to flatten the curve. Today, documented cases in Placer County are 133 out of a population of nearly 400,000, or 0.04%. Aggressively attacking this pandemic from a medical perspective a month ago was definitely the right course of action. But it comes at a significant cost to our economy. Thousands of Placer County residents are out of work. Businesses are closed, and many may not survive. City and county revenues required to fund essential services are being severely impacted. In the process of solving one threat to our community, we have created another. To date, the focus has been purely from a medical perspective, and rightfully so. But at this stage, as community leaders, we should also look at this pandemic from an economic perspective. Today, only businesses deemed essential are allowed to operate. This means 500 people can be in Costco, but 5 people cannot be at a car dealership. Or 200 people could be at Walmart, but 2 people cannot be in a bike shop. I would argue that every business is essential as it provides the means for families to survive. As leaders, we need to find ways that non-essential businesses can begin to operate on a limited basis. In conjunction with the health department to protect the at-risk population and to assure appropriate safety measures are put in place, I believe we can begin this process. The narrative to date has been to continue to shelter in place at least until May 1st, and the governor's orders are indefinite until changed. What kind of message does this send to our residents and businesses? Certainly not a message of hope. Placer County has a history of solving our own problems, a history of cooperation across jurisdictions. Listening this morning, I'm encouraged by the comments by Supervisor Euler related to moving to a more appropriate response to addressing and living with this virus as we see it today. This morning, I submitted a letter to the board on behalf of my fellow council members, and the focus of this letter is to begin the conversation on how we can implement a process to get all Placer County businesses open. In cooperation with the Placer County Health Office, city and county leaders, local chambers, and economic groups, we can do this. We have a community of entrepreneurs and small business owners who know how to adapt. We should be doing everything we can to empower them to be part of the solution. Together, we can help everyone recover from this pandemic, both medically and economically. And I look forward to working with you all on this. Thank you.
Thank you, Mayor Janda. Appreciate your comments. And next caller, please.
Good morning. Please state your name for the record.
Good morning.
Good morning. Please state your name for the record.
Hi, my name is Sherry Musgrove, and I would like to start this morning by thanking the board and Dr. Sisson in particular for all your efforts to keep us safe during these challenging times. Your decisions today and in the months to come will impact each and every member of this community in ways that right now we can only imagine. I know that you are under a lot of pressure to reopen Placer County and get our economy moving again. But please remember that for our economy to be healthy, the majority of our citizens need to be healthy also. Excuse me. The best way to decide how and when to relax the current order is to follow the guidelines provided by the medical and scientific community. Consider what they recommend and consider their warnings about the consequences of lifting the stay-at-home policy without the appropriate safeguards in place. Dr. Sisson has already commented on the 4 guidelines that need to be used to consider relaxing social distancing. These 4 are a baseline, and other experts think they also need to add the serological testing that Commissioner Wygant or Supervisor Wygant referred to earlier. Serological testing looks for antibodies in the blood, and that's what we can use to fight the infection, not prevent the infection itself. There seems to be a consensus among public health officers, most notably Dr. Deborah Bricks, the White House Coronavirus Response Coordinator, and Dr. Anthony Fauci, Director of the National Institute of Allergy and Infectious Diseases, and Placer County Health Officer Aimee Sisson, as well as many state governors, both Republicans and Democrats, that this is a reasonable and sound approach for moving forward. There also seems to be consensus that the weakest links, the measures that we don't yet have in place, are numbers 3 and 4. We don't have the capacity to test everyone who has COVID-19 symptoms, and we are not yet able to conduct monitoring of all confirmed cases and their close contacts. With regard to monitoring, we've had a lot of discussion today about the testing and where we are in testing, but I've not seen any information regarding the status of the county's monitoring programs. Perhaps Dr. Sisson could also explain what we are currently doing to monitor all confirmed cases and their contacts and how we are isolating to prevent further spread. Up until now, by following state and local social distancing orders, we have been very fortunate. We've minimized exposure and subsequent infection, reduced the impact on our healthcare system, and we've saved lives. But we should not be celebrating prematurely or reopen too quickly without the benefit of these additional testing and monitoring capabilities. Without more testing and monitoring, we can't know where we are, where our cases are, or how serious or when a surge may occur again. Finally, it's going to take all of us doing everything we can to learn about this virus as quickly as possible. How it's transmitted, how it manifests itself, how it can be treated, and how we can develop antibodies to protect ourselves against the virus. We need to know all these things in order to make good decisions, act responsibly as individuals, and keep the death rate in our communities as low as possible. Therefore, like I heard others on other agenda items this morning discuss, I would encourage this board to postpone not only reopening before sufficient testing and monitoring capabilities are secured, but also to postpone all non-essential public hearings where public input is expected or required. Preparing useful comments takes a significant amount of time to sift through the data, analyze and draw conclusions, and present findings. It took me many hours of research in order just to present these comments today. Right now, in addition to providing essential goods and services, all of our time is best spent learning about COVID-19 and responding to this crisis. The time for making non-essential decisions, including many land use and zoning decisions, is after we have necessary testing and monitoring in place. We've been able to relax our social distancing orders, and the board and planning commission chambers have been reopened to public attendance, and hearings no longer have to be conducted over the telephone. Thank you for your time and for listening.
Thank you for your comments. Next caller, please.
Good morning. Please state your name for the record.
Hi, my name is Emily Ann Ward, a constituent of Bonnie Gore District 1. I am part of an ad hoc committee of concerned Placer County citizens. And we wanted to, again, state our set of recommendations to the board this morning. And we're asking that you become partners with the state and federal representatives to identify opportunities to work with utilities, banks, telecommunications, and lenders to protect individuals against service interruptions, especially in our rural communities, and evictions due to non-payment from COVID, loss of income, and the state of California has publicly stated that the COVID-19 pandemic has subsided. In addition to that, I think that we are all facing significant challenges, and now is the time for strong community leadership to ensure that efforts to keep people safe don't cause long-term harm in our region's economy. We're asking that you utilize these recommendations and reduce jail population in order to protect against spread of the coronavirus through our county jail, and create a sophisticated plan around making sure that those inside receive proper health treatment and much needed social support upon their release, limiting arrests and having fewer people in jails to follow CDC guidelines on social distancing measures, and immediately suspend fines, fees, and restitution collection attempts until the CDC has publicly stated that the COVID-19 pandemic has subsided, including parking and traffic tickets. I know that the county CEO had previously mentioned that there was some type of mechanism going force for reducing jail population. I'd be interested in seeing how that is working. And working with all utility companies in Placer County, including gas, propane, electric, water, and sewer, internet providers especially, to waive late fees and avoid citizens being cut off from essential services due to non-payment. Thank you for your time, and that is all.
Thank you for your comments. Next caller, please.
Good morning. Please state your name for the record.
My name's Larry Welch.
Good morning, Larry. Go ahead.
Good morning, supervisors. Larry Welch again. I'm a board member on the Placer Community Foundation, a resident of Auburn, and a member of Cotavadera Country Club. I'm calling in to throw my thanks toward all our public health officials, Dr. Sisson and her staff and all of her team, for keeping us as safe as possible during the darkest days of the COVID-19 crisis. These are difficult and confusing times for all of us, and I sincerely appreciate the leadership and the extra effort that Dr. Sisson and her team have consistently demonstrated during the COVID-19 pandemic. Thanks in large part to their efforts, our county has some of the lowest per capita cases and deaths in the state, and obviously in the country. I'd especially like to thank Dr. Sisson and her team for how they handled the shutting down and then the careful and thoughtful reopening of golf and other recreational activities in Placer County. These were tough decisions, and they weren't popular. They were very controversial, both in closing and in opening. But taking both of these decisions was the right thing to do at the right time. Prior to the shutdown and reopening, I chose not to participate in golf because of concerns I had with my club not fully complying with all aspects of the original public health order. Those are concerns I think that should be shared as we reopen any business. My concerns about playing golf were never about golf itself. Golf is inherently an individual activity played in large open spaces, and it's easy to social distance, and there are tons of mitigating factors that have been implemented and recommendations that have been implemented to ensure no one touches common equipment and that the course is as safe as possible. What concerned me and prevented me from playing golf were the struggles my club was having ensuring safe practices off the course, maintaining safe distancing, preventing groups from gathering, ensuring all food and beverages were takeout only and did not get consumed on site. The order to shut down golf courses and then thoughtfully reopen them with amended health orders and very specific operational guidance was a wake-up call for my club and other clubs in the Placer County. I've heard anecdotally from other people that some people think all clubs were in compliance. They weren't. I know my club wasn't, and I know other clubs weren't. Our club, I'm happy to say, is now in full compliance with Health and Human Services orders and has a new slogan for all its golfers: Park, Golf, Go. I think the work that was done to shut down and reopen golf is a good example of how we can work together to figure out how to get businesses back in business and still comply with safety measures that are critical for us, not have to re-step back into earlier phases or earlier parts of our release of businesses back into business. So just some comments. I again applaud County Health, Dr. Sisson, and I thank all of her team, and I appreciate everything they're doing and you're doing to keep us safe. Thank you very much.
Thank you for your comments. Next caller, please.
Good morning. Please state your name for the record.
Good morning. My name is Kathleen Crawford, and I am a resident of District 1 in Placer County in the city of Roseville. I want to support the comments that were made by Mayor Allard in terms of what the city of Roseville is doing. And I'd also like to support the report that we heard from Dr. Sisson, where she was very clear about the need for additional testing before we can move into phase 2 the gradual reopening, which he had 3 phases up there on the slides. And I thought that they were thoughtful and quite a rational introduction and approach to reopening businesses. So I think that once we get to the point of testing, there has been a sufficient amount of planning to start to move ahead in this fashion. But I am concerned about the lack of available testing. And particularly when you look at vulnerable communities, communities in our convalescent homes, communities in our jails or group home situations. And so I really urge us to very carefully and slowly make sure that we have the available testing for the public as well as those in hospital care, so that there can be confidence that we are moving in the right direction. I would also like to caution the second part of the relaxation on the recreational facilities. I understand golf can be much more of a solo activity, and they have staff there to monitor compliance in terms of distancing and only families together in a cart and things like that. However, the relaxation of sports courts and dog parks is not the same type of issue, and the city of Roseville has not reopened the sports courts or the dog parks, at least to my knowledge. And the reason for that is that there is no staffing at those sites. There is not sufficient sanitation at those sites, and it is a local enforcement issue, and particularly if you start to see a group of young people congregating, particularly like at a basketball court or in tennis courts or places where they would have an opportunity to start congregating. So I really appreciate the thought that went into it, but I do think specific areas that have more density in population, like the city of Roseville, may in fact have stricter need for continuing the physical distancing in order to keep the sheltering in place safe for the community at large. Thank you very much for the work that you're doing. I very much appreciated the information today, and I will continue to be hopeful that the Placer County leadership moves ahead in a slow but thoughtful fashion. Thank you.
Thank you, Kathleen. Appreciate your comments. Next caller, please.
Good morning. Please state your name for the record.
Good morning. This is Cheryl Bergama, and I'd like to ask Dr. Sisson, first I'd like to thank her for all her tireless work and working on committees and being part of a larger effort. I think we're all very fortunate that we live in California and have a governor that has such a detailed plan. We have the best resources on the planet, and I encourage Dr. Sisson to please work with the governor on and support his orders. I think Placer County living on their own kind of island mentality is not the way to go. I think that there's border issues, there's testing issues, there's latest information. We have some of the best medical on the planet, and I would encourage that we follow those guidance. I would like to comment on something Supervisor Euler said about we know the risks. I'd like to plant the mental image of the mass graves in New York, where just thousands upon thousands of people are dying from what we thought was respiratory. Now it's kidney failure, could affect the brain. There is so much involved, and it's not going to matter if we don't have our health care under control. I would actually urge the opposite, that Placer County work with, the governor has a task force. He's enabled, again, some of the best and most qualified people on the planet to move forward with a plan. Dr. Sisson's plan is a plan. It's got an ordered set of events that needs to happen with criteria. I urge Placer County to work with those criteria and for Dr. Sisson to do the same, to work with the governor. We have so much effort in place, and I think that we should follow along that. I also have a question about random testing, besides testing itself, obviously if you go into congregate care, you're testing people that are already suspect for and at higher risk. But until we can actually have widespread testing and the right types of testing and move on the multi-pronged approach, I too am concerned about testing. The other thing I wanted to ask Dr. Sisson about was Project Room Key. Last time she spoke about having places to put infected individuals. I know in my community in District 4, there are young homeless camps out there. Where are these people going to go? What are they going to do? I think we need to hear more about how can we contain the situation within our county before we start lifting, because those people are possibly infected. So what are we going to do with that? So testing is a concern, and then I heard Cindy Gustafson talk about wanting to delay. So what I'd like to also know, because they're rural, from Dr. Sisson, what are the rural versus urban resources and challenges? What do
Thank you,
need?
Cheryl. Can you wrap up your comments, please?
Okay. As a health officer, what do you need from Placer County to make sure you have the testing that's available? Is it resources, testing, funding? What do you need, and how can we make that happen? Thank you.
Thank you. Next caller, please.
Good morning. Please state your name for the record.
Good morning. It's Veronica Blake, CEO at Placer Community Foundation.
Good morning, Veronica.
Good morning. I'm calling just to speak out in favor of our public health professionals who are leaning into this crisis around the clock and day after day. We have the privilege of witnessing their efforts through the Community Foundation's partnership for our COVID-19 response effort. The level of communication and coordination is really remarkable between Placer County Health and Human Services, the Community Foundation, and the safety net providers so that we can best respond to community needs. Because of this, we've been swift and strategic to deploy over $100,000 to our most vulnerable citizens. This collaboration is something that we should all be proud of. Dr. Aimee Sisson in particular is someone who should be recognized and appreciated. She carries the duty of being our public health leader in this unprecedented crisis. Her job is enormous to protect every citizen in our community from this ruthless virus. The stakes have never been higher, and she faces uncharted territory where every decision carries the potential for the life or death of thousands of people. Placer County in particular has one of the oldest populations in the state to look out for. As you can relate, being a good leader is both an honor and a burden. In this crisis in particular, it's an impossible situation to protect and please everyone in our community. We feel powerless, we feel impatient, we feel scared, and I think we're all struggling with where to direct these uncomfortable feelings. However, we can't confuse the faceless enemy that is COVID-19 with the face of our public health officer. As community leaders, we have the platform to bring us all together. We can fight the virus and the frustration in our lives by building each other up and leaning in for each other. I'd also like to shout out to Jeff Brown, Raul Martinez, Mike Romero, Ryan Fruitnick, Wendy Williams, Lauren Lake, Katie Combs-Pritchard, and everyone in the Public Information Office and Health and Human Services Department. I hope that you'll all join me today in recognizing our public health heroes and appreciate all the good work you're doing to keep our community safe. Thank you.
Thank you, Veronica, and thank you to you and your team, the Placer Community Foundation, and the work that you're doing to raise funds for the COVID-19 Relief Fund. And next caller, please.
Good morning. Please state your name for the record.
Julia Sweeney, and I'm from Roseville.
Go ahead, please.
Thank you. I'd first like to say thank you to Dr. Sisson and all of the public health and human service staff members, as well as the Board of Supervisors and all of the staff. I know that this is a very trying time for everyone, and I really appreciate all that you are doing to keep our community safe. I submitted a letter this morning, but wanted to call in since the time was adjusted a bit after watching the presentation from Dr. Sisson and some of the comments from the board. I really appreciated the additional insight that Dr. Sisson provided about what health experts, and as well as herself, another health expert, recommend needs to happen before we can move forward with reopening gradually and intentionally. I think it was really great to see that our social distancing and shelter in place and restrictions have been effective with slowing down the spread of disease and death. And, you know, I appreciated actually one of the first callers, Mayor Allard. I was able to hear that comment before getting into the queue. And I liked that he said that we should not become a victim of our success. And I think that looking at the charts that Dr. Sisson showed, that what we are doing is working, should not give us the idea that we should then stop too soon. There is still a severe lack of adequate testing, and that has to be addressed before we can really start to roll things back. And I know that all of you know that. I just think it's important that you continue to hear that from the community, that we want you to do whatever is necessary to keep us safe and to reduce the risk of disease and death spreading at a higher rate. I also want to echo some of what I wrote in my letter this morning, that the board continue to take a leadership role in deferring to the health experts when deciding what to do with restrictions. In listening to some of the comments, I did want to express some concerns around Supervisor Euler's comments. You know, talking about the fact that there's just an associated risk of just living, and that this mortality rate is much lower than we anticipated, that being a leader in such a high position of influence and diminishing the risk here or downplaying the risk to our community, I think can be dangerous. And so I would really just like to caution that everyone on the board be very intentional with the tone and the way that we are speaking about this. You know, the question was posed by Supervisor Euler in his comments. At what point do we say, we've claimed victory, we didn't overrun the healthcare system, now let's reopen some things? And I think that Dr. Sisson answered that question. We reopen when those 4 points are addressed: adequate testing, positivity rate going down, medical capacity, and contact tracing ability. So I would say that we have medical experts, and just to make sure that we are listening to them and we are putting our full support and confidence in the science that is driving these restrictions.
Thank you so much. Can you wrap up your comments, please?
Okay. Well, thank you so much for all that you are doing, and please continue to do what is necessary to keep us safe. Thank you.
Thank you very much. Do we have any more calls? All right. We will close public comment. We appreciate everyone sharing their opinions. I know there were a couple of questions. So Dr. Sisson, if there's any clarification you wanted to make based on the public comment, feel free to do so.
Sure. Thank you for the opportunity. I know one of the questions that was asked was around the capacity of public health to do contact tracing and monitoring. So I wanted to share some of our numbers and some of what's being suggested by experts about what that capacity needs to be. So prior to the coronavirus epidemic, our communicable disease team here in public health consisted of 6 individuals. We have ramped up by borrowing from other public health sections, if it were, as well as other Health and Human Services agency staff, and bringing on some extra help staff. So we've essentially tripled the size of our team to 18 who are able to do contact tracing and monitoring. But even with that larger team, we've had to limit our contact tracing to vulnerable population exposures, and we are not doing ongoing monitoring of cases on a daily basis. So as we look to the future and relaxing restrictions and the possibility that would be accompanied by increased cases, I do have concerns that our capacity to do the robust rapid contact tracing that would be necessary to avoid a surge in cases is not yet where we need to be. The National Association of County and City Health Officials, or NACHO, has estimated that contact tracing capacity needs to be approximately 30 contact tracers per 100,000 population. So that would, for Placer County, would mean approximately 120 people on the contact tracing team. And while that may be an overestimate, it certainly is a much larger number than the 6 that is our baseline and the 18 that we have expanded to. So we would be looking, and we are looking at solutions for that, but I did want to speak to that capacity. I think one of the other questions was around what do I need as the public health officer in terms of resources, and specifically around rural versus urban resources. And I think, speaking to the testing limitations, what we need is more swabs, and that cannot be created within Placer County. And we also need more laboratory capacity. And again, that's not something that can be created within Placer County. So we're certainly working with state partners there and have been submitting requests. We've also been doing our own procurement of swabs and other necessary supplies. So I'm happy to state that as of today, we have enough swabs to test people. But if we test on a large scale like we need to, we will go through those swabs quickly. In terms of rural versus urban resources, I think one of the things that we've been trying to reiterate is the limited capacity of the healthcare system in our more rural areas, especially Lake Tahoe, and encouraging people to stay home as much as possible, to not travel to the North Lake Tahoe area unless it's essential, so that we do not have a lot of extra people in that area who would overwhelm the small healthcare system up there. And I appreciate the cooperation that we've seen to date with people, and that hospital is doing well right now in terms of capacity. So I want to thank everybody for staying home. And then I think the last piece that I would address based on a direct question was to speak to Project Room Key and our efforts to address the homeless in terms of COVID-19. And we have had, our team has been working very hard on this. As I commented at my last presentation, we have struggled to find business owners in the community who are willing to open their doors to our homeless population, especially homeless population who may be under quarantine or isolation for COVID-19. And that has been a tremendous challenge in identifying rooms, but we have had success. We have at least one hotel that is currently housing homeless people with COVID-19. But again, I would encourage anyone who is listening or watching who is a hotel owner to please reach out to us, because we do need more rooms so that we can protect our vulnerable population. And when we do have people who test positive in our shelter, that we have somewhere where they can go to with their own room and their own bathroom, so that they don't expose 100 other people to coronavirus. I think I'll stop there.
All right, thank you, Dr. Sisson. Appreciate that very much. Supervisor Euler?
Yes, thank you. I want to take the opportunity to first address a couple of the comments that were made to me directly, first by Ms. Berkema. First of all, the abject absurdity of trying to compare Placer County and our situation to New York City, when Placer County has 5 times the area of New York City and 5% of the population of New York City. So ridiculous comparison, number one. Number two, there are no mass graves in New York City. In fact, the president sent one of our hospital ships to New York that was quickly then returned back to the Maryland area because it wasn't being utilized. The Army Corps of Engineers built a hospital in their convention center that had, I believe, about a 1,000 bed capacity, and they saw approximately 20 patients. So to compare us in the first place is ridiculous, and then to further assert that the city is somehow awash in death like the Black Plague is further ridiculous. To the comment that I am downplaying the risk, no, I'm not downplaying the risk. I want an honest conversation about what the risk really is, because I believe we have passed the point of the devil that we know being better than the devil that we don't know. I believe the devil that we don't know is now worse than the devil that we know. Because the devil that we, pardon me, the other way around, because the devil that we know is a failing economy. The devil that we know is supply chains coming apart. The devil that we know are thousands and thousands of small businesses closing, 20 million people on unemployment. That's the devil that we know. The devil that we don't know shows more and more signs that it's nowhere near as lethal as we all thought when we all said we had to rush to shut everything down. So I'm asking for a sober, real conversation about the point of diminishing returns, when we will have gone so far down the path of shutting down our economy that if we want to fund essential services, we won't be able to. We are not the federal government. We don't have a printing press in the basement. We can't just go print $6 trillion. We have to deal with the revenues that we get here based primarily on property tax. And if you don't think for a moment that we are going to see a crashing of our property tax values led, unfortunately, by our commercial sector that is getting decimated as these businesses are closing, we have got to be able to deliver essential services at the county, ongoing, when businesses pick back up, when life resumes to normal. We will be a lagging indicator. Those of us who have lived through this before know that we see our decline in revenue a year to 2 years after the catastrophic event. We won't see our decline in revenue here in Placer County for a year to 2 years after this catastrophic event. That's what I'm planning for. That's what I'm asking us to have a conversation about. At what point do we say we have essential services we have to provide today? We're meeting the demand today. We're taking care of the people who are sick today. It's the people that are going to be in this county requiring public protection, requiring health and human services, requiring a functional court system and a functional prison system. Those are the folks that I care about. I care about my kids and my future grandkids and our ability to serve them. And saddling this country with debt by shutting down our economy is not the right way to do it. The Health and Safety Code is not a suicide pact. We are not bound to everybody going down with the ship. It's time that we have an honest discussion. At what point do we say, we know this devil, we don't know this one? The toll that this one has taken has exceeded our worst expectation of this one, and it's time to change course. I think we're there. And all I'm asking is that just as at the federal level, the president has recognized that it is up to the states to come up with a plan to reopen their businesses, to engage in policy that is in the best interest of their citizens, I would encourage the governor, whose experience is running the city of San Francisco, to recognize that the state is very diverse. We have an awful lot of folks at the local level who are very familiar with our communities and understand our local needs. Allow us to address the needs in concert with Dr. Sisson, in concert with Kaiser and with Sutter, with all of our healthcare providers. Allow us at the local level to address our local needs and get our local economy started back up. That's what I'm talking about.
Thank you, Supervisor Euler. And I want to piggyback on that as far as the county is will experience the decline in property tax, but our cities right now are experiencing the decline in sales tax, and they are reliant on sales tax, which is why we heard from the mayors of Rockland and Roseville, because they're hurting right now because of the decrease in their sales tax. So we need a balanced approach of how we get back to work. We can not continue this everything shut down for a long period of time because we already have people out of work. We already have a huge decrease in sales tax. And when we talk about public health, we're talking about economic health as well. When people don't have jobs, their mental health declines, their physical health declines, and that's a public health issue in and of itself. I agree, we've got to really look at what we can do to start getting our businesses back up and running so that people, we can get our economy moving forward again. Supervisor Gustafson and then Supervisor Wygant.
I agree with a balanced approach and trying to look at what we've got to do here to move our economy along while protecting public health. I would just ask that we also consider differing municipalities and regions of our own county. And so earlier, a commenter thought I asked for a delay countywide. No, I just said that some of the businesses in North Lake Tahoe are concerned about the rollout of this, and they want to be involved and make it the best rollout it can be as we move into the next transition. So as flexible as we can be as a county and with our health officer to have a rollout that works timing wise appropriately for various types of businesses. I just wanted to clarify that.
Certainly, thank you. Robert.
Kirk, I'd be remiss if I didn't say I appreciate your enthusiasm. And also, I just want to establish the fact that I essentially concur with you. I think the center is we do need to have a more balanced, thorough conversation about the trade-offs. There are huge implications that we're going to have to deal with here at the county going forward, in addition to the ones we already have, but it'll include how we react to our resources, even in terms of economic development. And one of the key drivers for me is that I've always been a strong philosophically, I've always been strong on the idea that this American experiment is supposed to emphasize individual governance to the fullest extent possible and minimize centralized government to the maximum amount possible. And everybody, I think, needs to think about that as we're going forward with this whole thing. There is a lot. When we started out, mostly what we knew is that we didn't know good information to make intelligent conversations. We do know now there are economic indicators coming out daily now. And as I mentioned before, you know, backgrounds in finance, but I've studied enough economics to be dangerous. And I firmly believe that there is huge risk to not normalizing as quickly as possible under known risk to an extremely serious economic platform. And we'll all be dealing with that. And even health issues related to that will be very compelling. And we'll know a lot more in a year. Hopefully things will normalize quickly enough, but then locally I want us to do some work and research so that we can be better prepared for these kinds of things going forward, both locally and have a platform upon which we can lobby at the state and federal level.
Thank you very much. All right. Thank you everyone for the robust discussion. And appreciate all the work everyone's doing really during these unprecedented times and challenging times.